Ever feel like you're just drowning in complex information? Like you're trying to put something together, but the instructions are just impossible.
Yeah, happens all the time.
Well, that's kind of what the deep dive is for. We try to take that overwhelming stuff and, pull out the bits that really matter, help make sense of it.
Hopefully give you one of those aha moments.
Exactly. And today, we're tackling a pretty heavy topic. Diabetes mellitus with hyperosmolar coma. It's a serious health condition.
It really is. And we've dug into some detailed medical sources to try and paint a clear picture for you.
So our mission here basically is to get to the heart of it.
Hmm.
What is this condition? What causes it? And crucially, why is it so dangerous?
We're aiming for clarity. Translating the medical jargon, you could say.
Right. We've waded through the dense info, so you don't have to. We'll point out the really key takeaways.
So let's start with the name itself. Diabetes mellitus with hyperosmolar coma. What are we actually talking about here?
Okay, yeah, let's break that down. So medically, it's defined by a cluster of severe problems happening all at once. You've got really high blood sugar, that's the hyperglycemia.
Off the charts high, often.
Then there's hyperosmolarity. Think of the blood getting like super concentrated, like syrup.
Mm-hmm. Thick and concentrated.
Plus severe dehydration. And here's a key thing. Unlike another diabetic crisis, DKA usually don't see a lot of ketones.
Right. Ketones aren't typically the main driver of the acidosis here.
You might get some mild to moderate metabolic acidosis, but it's often from something else. And definitely central nervous system depression, things slowing down in the brain.
That word severe pops up a lot in the description.
It really does, and it tells you just how critical this is.
But what's going on underneath all that? What's the root problem?
It boils down to not enough insulin, or the body not responding to it properly.
And insulin's job is to help sugar, glucose get into the cells for energy, right?
Exactly. So if insulin isn't doing its job, that sugar just piles up in the bloodstream.
Which then causes?
Well, that super high sugar in the blood acts like a sponge. It starts pulling water out of the body's cells.
Hence the dehydration. It's happening at a cellular level.
Precisely. And that kicks off this whole dangerous chain reaction.
Okay, so the cells are getting dehydrated internally. What happens next?
Well, the kidneys get involved. They try desperately to flush out all that extra sugar.
Which must put a huge strain on them.
It does. It leads to waste products building up. That's azotemia and uremia. The kidneys are just overwhelmed.
And does that make the dehydration worse?
Yes, because damaged or overwhelmed kidneys can't conserve water effectively. So you get worsening dehydration, and eventually the body's tissues might not get enough oxygen. That's tissue hypoxia.
Wow. Okay, so back to the acidosis you mentioned. If it's not mainly ketones, what causes it?
Good question. The sources point towards increased lactic acid usually being the culprit.
Lactic acid. I'm with.
Well, when the body is under severe stress, like from the dehydration and poor circulation and tissues aren't getting enough oxygen, they can switch to a different energy process that produces lactic acid as a byproduct.
So it's a different kind of acid buildup than in DKA, driven more by the lack of oxygen and stress.
Kind of, yeah. Though you can still get some ketones if the animal hasn't been eating for a while, but it's usually not the dominant feature like in DKA.
Okay, so it's like this cascade hitting multiple systems. Let's talk about those specific systems, the kidneys, obviously.
Yeah, the kidneys are definitely hit hard. The low fluid volume and poor blood flow cause problems before the kidney, prerenal azotemia, and can even cause direct damage to the kidney, primary renal azotemia.
And you mentioned something interesting before. The urine can be dilute, even with dehydration.
Right. Seems counterintuitive, doesn't it? But it's that osmotic diuresis thing again. The sheer amount of sugar in the filtering system pulls water out with it, making the urine dilute, even as the body is desperately short on water overall.
That makes sense. And what about the cardiovascular system, the heart and blood vessels?
They're under immense strain. All that fluid loss leads to low blood pressure hypotension.
Which can get really dangerous, right?
Absolutely. It can progress to vascular collapse, and the heart muscle itself can weaken because it's working so hard with less fluid to pump and potentially less oxygen.
And then there's the nervous system. The coma part of the name is a big clue there.
Definitely. The brain is really sensitive to both dehydration and that high concentration, the hyperosmolarity.
How does that affect it?
Basically, the brain cells themselves lose water, and the concentrated blood interferes with normal nerve function.
So you see symptoms like
It's a spectrum. It can start with just depression, disorientation, confusion, but as that osmolarity climbs, it can progress to seizures and eventually coma.
So the severity of the neurological signs is directly linked to how concentrated the blood gets.
That's what the medical texts indicate, yeah. Higher osmolarity, worse CNS function.
This sounds incredibly severe. Is it common?
Thankfully, no. While diabetes itself isn't rare, this specific severe complication, the hyperosmolar coma, is described as uncommon.
Okay, that's somewhat reassuring. Does it affect dogs and cats differently?
Yes, and this is interesting. The sources say it primarily affects cats, much less common in dogs.
Really? Cats more than dogs. I might have guessed the other way around.
Yeah, it's quite specific.
Any patterns within those species? Like age or sex?
There seem to be some trends. In the few dogs that get it, it's often middle-aged to older, maybe 7 to 9 years old, and potentially more common in females.
Okay, and cats?
Cats, it can happen at any age, but most are older, say, over 6 years. And it seems neutered male cats are reported more often.
Interesting differences. Might point to underlying factors we don't fully understand yet.
Could be hormones, how diabetes progresses in different species. Lots of possibilities.
So, thinking about pet owners,
Yeah.
what are the early warning signs they might spot? Things that might hint trouble is brewing.
Often it starts subtly, with the classic signs of diabetes maybe getting worse, like drinking a lot more water, urinating much more frequently.
Polydipsia, polyuria.
Right. And maybe they seem ravenous, always hungry, polyphagia, but they're still losing weight. Those are red flags for diabetes in general.
But this condition goes beyond that, doesn't it? What are the later signs that signal a real emergency?
This is where things get really serious and often quite fast. You'd see increasing weakness, maybe vomiting starts, they lose their appetite completely, anorexia.
Becoming withdrawn.
Very withdrawn, depressed, they might seem out of it, kind of stuporous, not responding normally. And then the worst case, coma.
So any of those later signs, weakness, vomiting, not eating, major lethargy,
Yeah.
that's time for immediate vet attention.
Absolutely, it's a true emergency.
And when a vet sees a pet like this, what findings on the physical exam point towards this diagnosis?
The exam usually screams critically ill. Severe dehydration is a big one, often estimated at 10, even 15%.
Wow, that's a lot of fluid loss.
It is. They might have a low body temperature, hypothermia. Their gums might be pale, and if you press on them, the color returns slowly. That's poor circulation.
Slow capillary refill time.
Exactly. And marked lethargy, depression. If the osmolarity is sky high, you might see seizures, or they could already be in that stupor or coma.
Anything else?
One interesting finding mentioned, particularly in dogs, is the presence of cataracts, cloudy lenses in the eyes.
Okay, so we know the signs. Let's circle back to the why. What are the ultimate causes and the biggest risk factors?
Well, the core issue is that combination. Underlying diabetes, plus that severe hyperosmolarity, the extremely high blood sugar, the kidney compromise, the prerenal azotemia, and of course the severe dehydration. It's all tangled together.
It's not just one thing, it's the perfect storm.
Pretty much. And having other health problems seems to significantly increase the risk.
Like what kind of problems?
Things like underlying heart disease or chronic kidney insufficiency. Also, acute issues like pneumonia, severe pancreatitis, even cancer or other major infections or illnesses can push a diabetic animal into this state.
So concurrent disease is a major player.
A huge risk factor, yeah.
Are there any medications that owners should be aware of that could potentially trigger this?
Yes, the sources do mention a few. Certain anticonvulsants used for seizures, glucocorticoids, those are steroid medications, and also thiazide diuretics, sometimes used for fluid management.
Good to know. Okay, so a pet comes in showing these alarming signs. How does the vet pinpoint this specific condition versus other things that might look similar?
That differential diagnosis step is crucial. They need to rule out other possibilities.
Such as?
Well, something like myxedema coma, which is from severe low thyroid function. It can cause lethargy, mental dullness, but the thyroid levels would be the giveaway.
Okay, what about just regular diabetes?
Uncomplicated diabetes will have the high blood sugar in the urine, but the key difference is the animal is usually still relatively bright and alert, not profoundly depressed or stuporous.
Right, and the big one we mentioned earlier, DKA. Diabetic ketoacidosis. How do they tell them apart?
That's the critical distinction. DKA also has high blood sugar, glucose in the urine, and the animal is sick. But in DKA, you expect to find significant levels of ketones in the urine and blood, and usually a more severe metabolic acidosis driven by those ketones.
Whereas in this hyperosmolar state,
Exactly. The defining features here are the extreme lethargy or depression, the severe hyperosmolarity and hyperglycemia, and the severe dehydration, but typically without those high ketone levels. That combination points strongly towards this diagnosis.
so lab tests are absolutely key then.
Indispensable. Blood work is critical.
What are the main things they look for in the blood?
Okay, so number one, blood glucose. It's usually very, very high, often quoted as being over 600 milli-GDL.
Wow. Okay, what else?
Kidney values BUN and creatinine will typically be elevated, showing that kidney stress or damage. Sodium levels are often high, too, hypernatremia.
What about potassium?
Potassium is tricky. It might look normal or even low on the blood test, but the animal's total body potassium is often depleted. However,
Yes.
if the kidneys have shut down and they're not making urine, then potassium can actually build up and be dangerously high. So it depends on kidney function.
Got it. Any other key blood markers?
Yes, they'll look at indicators of acid-base balance. Bicarbonate or TCO2 is usually low, and the anion gap is often high, both suggesting metabolic acidosis.
And urine tests.
Definitely glucose in the urine glucosuria. And, as we discussed, often a low urine-specific gravity despite the dehydration.
Are there any other really specific tests for this?
Measuring the serum osmolarity directly is a big one. It will be very high, usually over 350 millismol.
Some vets can estimate that too, right?
Yeah, there's a formula using sodium, potassium, BUN, and glucose to get an estimate, which is really helpful clinically. Also, checking plasma lactate levels can confirm lactic acidosis if ketones aren't the main issue.
Okay. And things like x-rays or ultrasound are usually needed right away.
Not typically for the initial diagnosis. That relies mostly on the clinical picture and those lab results.
But the sources mention some findings later on.
Yes, pathologically, like after death, they might see changes in the pancreas, different changes noted in dogs versus cats, and potentially signs of brain damage like tissue death or blood clots, likely from the severe metabolic derangement.
Right. Okay, this is clearly a dire situation. Let's talk treatment. What can actually be done?
First and foremost, this is an absolute emergency requiring hospitalization, usually in an intensive care setting. Treatment is complex.
And fluids must be a huge part of it.
The cornerstone, really. Careful, calculated fluid therapy is essential,
How do they give the fluids?
primarily intravenously. Although if the animal isn't comatose and can tolerate it, sometimes small amounts of oral water via a nasogastric tube might be considered, but very carefully due to aspiration risk.
So mostly 5E fluids. Is there a specific strategy?
Yes, it has to be gradual. The aim is typically to replace about half the calculated fluid deficit in the first 12 hours and the rest over the next 24 hours or so.
What kind of fluids do they use?
It depends. If blood pressure or sodium is low, they might start with normal saline, 0.9% sodium chloride. If sodium is high, they might use half normal saline, 0.45%. But they have to lower that sodium level slowly.
To avoid shifting fluid into the brain too fast.
Exactly. Potassium is usually added to the fluids too, unless the initial level was high.
And when do they switch fluids?
Once blood pressure and urine output stabilize, they might switch to half normal saline if they started on normal saline. And a key point, once the blood glucose starts coming down, say below 250 milli-GDL, they need to add dextrose sugar to the IV fluids.
Why add sugar when the problem was high sugar?
Because they'll also be starting insulin, and they need to prevent the blood sugar from dropping too low or too fast. They continue the dextrose fluids until the animal is stable and eating.
Okay, that makes sense. What about diet during this initial phase?
Diet isn't the focus right at the beginning. Stabilization comes first. Once they're through the crisis, then diet becomes important for long-term diabetes management.
Which involves?
For dogs, often low-fat, high-fiber, complex carbs. For cats, usually low-carb, high-protein is preferred, but that's after the emergency.
Right, and the other major component must be insulin.
Absolutely essential. But importantly, it's usually started a couple of hours after fluid therapy begins.
Why the delay?
Starting fluids first helps improve circulation and kidney function, which can actually help the insulin work better, and reduces the risk of complications from dropping the sugar and osmolarity too rapidly before the dehydration is addressed.
Okay. How is the insulin given?
Often as a constant rate infusion, CRI, intravenously, using regular insulin. There are specific protocols for dosage.
And you mentioned something about the IV line.
Ah, yes. Apparently, insulin can bind to the plastic tubing, so it's often recommended to run some of the insulin solution through the line and discard it first to saturate those binding sites.
Interesting detail. How do they adjust the insulin dose?
They monitor blood glucose closely and reduce the infusion rate once the glucose drops below that 250 milligdl threshold, coordinating with adding dextrose to the fluids.
And then eventually they switch off the IV insulin.
Yes. Once the animal is stable, hydrated, eating, and drinking, they'll transition to a longer-acting insulin given by injection under the skin formulations like glargine, PZI, or Lente for ongoing management.
And treating any other problems they found.
Critically important, if there was underlying kidney disease, pancreatitis, and infection, those need to be managed concurrently.
You mentioned lowering blood sugar and osmolarity slowly.
Yeah.
What are the big precautions during treatment?
That's the main one. Avoid rapid decreases in either blood glucose or serum osmolarity.
Because of the risk of cerebral edema, brain swelling.
Exactly. If the concentration of the blood drops too quickly compared to the fluid inside the brain cells, water can rush into the brain cells, causing swelling, which can be catastrophic. It's a real balancing act.
A very delicate process.
Yeah.
So once they're through the initial crisis, what does the follow-up and monitoring look like?
Intense monitoring continues. Blood glucose needs checking very frequently at first, maybe hourly, to guide the insulin and dextrose adjustments.
What's the target rate for glucose drop?
The aim is generally a gradual decrease, around 50 to 100 milligdl per hour until it reaches that 250 mark. You want slow and steady, not a sudden crash.
What else are they watching closely?
Urine output is critical, watching for signs of kidney failure. They'll also monitor hydration status, heart function, sometimes with ECG, maybe central venous pressure, electrolytes, kidney markers like BUN, and urine glucose frequently during stabilization.
And for the long haul, managing the diabetes.
Long-term, blood tests like glycosylated hemoglobin or fructosamine give an idea of glucose control over the preceding weeks to months. And owners need to be vigilant for any return of those initial signs, increased thirst, urination, appetite changes, which might mean the insulin dose or diet needs adjusting.
Okay. Finally, what about preventing this in the first place, and what are the potential bad outcomes?
Prevention really hinges on good, consistent management of the underlying diabetes. Avoiding incorrect or insufficient insulin dosing is key.
And during treatment, avoiding complications.
Yes, preventing treatment-induced problems like hypoglycemia, low blood sugar, hypokalemia, low potassium, or hyponatremia, low sodium, is vital.
What are the most severe potential complications of the condition itself?
Unfortunately, despite treatment, irreversible coma and death can occur, especially if there's significant pre-existing kidney disease. Acute kidney failure developing during the crisis is also a major risk.
So realistically, what are the chances? What's the prognosis?
The sources describe the prognosis as guarded. Even though clinical signs and lab values might start to improve within the first 24 hours of aggressive treatment, it remains a very dangerous condition.
It really underscores the severity.
It really does. So wrapping up this deep dive, we've seen how diabetes mellitus with hyperosmolar coma is this really dangerous combination of extreme high blood sugar and severe dehydration.
Yeah, creating this cascade that hammers multiple body systems, kidneys, brain, cardiovascular system.
It highlights just how interconnected everything is in the body, doesn't it? And how vital, prompt, careful treatment is. Also recognizing those early, maybe subtle signs of diabetes getting out of control.
Absolutely. That interconnectedness is fascinating. A metabolic issue, glucose regulation, triggers fluid shifts, organ dysfunction. It really drives home the complexity.
It makes you pause and think, definitely. You know, given how this condition shows links between, say, metabolism and neurological function or fluid balance and kidney health, what other symptoms that might seem unrelated could actually be connected to some deeper underlying issue?
That's a great question to ponder. Always looking for the bigger picture in health, whether it's for ourselves or our pets.
Something to keep in mind.